got one more change.
Two.
Okay, two more changes. So here you go. Here's your change for the day.
So while this is loading, I'm sure most of you have seen that we made a change to the phone note form. We took away the first page and just made the background and the situation all in one page. We're going to make one small minor change to that first page and move the reason for contact to the top underneath the caller info and have the background information on the bottom. We got some feedback from providers. Okay, yay! We got some feedback from providers and staff, and Dr. Versa asked me to make that change. So I wanted to let you guys know before I implemented it this weekend, so it'll be there on Monday morning. Okay. All right. So what we're going to talk about today is, you guys should all have this sheet, right? Okay. So how many of you currently use pre-visit forms in your clinics?
Everybody.
A few? Two? Three? All of the same day should be raising their hand. Should be.
Okay.
Heartland same day, at least. Okay. So what we've done is we've been working on a new form component for the EMR that will replace the initial page when you log in. So currently you have that the initial page that has like the vitals and the medications, allergies, problems, updates. What's going to be replaced with this form here. I'm going to go ahead and pull it up really quick. This form, maybe I pull it up.
I got like 30.
What?
It's like, can we work on my desktop while we're here?
No. This form goes the same with the same flow as the pre-visit form. So the idea of the pre-visit form is you have the patient fill it out in the waiting room while they're waiting, and then they bring it back, and the MA inputs that information into the visit, right? Okay. So this form will follow the pre-visit form. It'll also make it so you don't have to go to really a bunch of different places within the visit to fill in review systems, HPI, chief complaint, risks, so like the smoking status, the alcohol use, things like that. So it'll all be on one form and there for you to just do and follow the flow of the pre-visit.
So if the risk factor form has already been filled out in the past, is it like the flow sheet is going to migrate into this new one? Like, so the patients, okay.
It's all connected the same. Okay, so we should probably change.
So if we've already filled it out previously, it'll just be there.
Yep. So here's what it looks like. So we're just going to start at the top and work our way down. We're just going to kind of quickly go through this as much as possible. So how many of you actually put in a chief complaint and an HPI? Put in both? A lot of you? Oh, more than we thought. Okay. So we wanted to really, Dr. Versa, when we were creating this, really wanted to separate those as much as possible. So a chief complaint is what?
Why they're there.
The main reason why they're there, and the HPI is the history of it. So he really wanted to separate those two out. He finds sometimes that a lot of there's no chief complaint listed, and it's all just an HPI. So he really wanted to like separate that out. So we have the chief complaint box here, and then you can free text the HPI here, or you can, oh, it's not going to open, but you guys know what it looks like because I don't have it connected to an office visit. We open up the HPI form and it has the boxes you can choose from for the certain forms. And then to get back here, you just close and reopen this form like you have to already. And then you can go down. Doesn't that?
Oh, I'm just turning some lights down. I'm
Oh.
not in trouble. Oh my gosh.
Well, no. I didn't think about jumping in, but
I'm just trying to give
Okay.
you guys some. Can you guys see better when I do that? Better when you start on.
yeah.
Turn them all on.
Okay.
light out.
So on this sheet, Deanna and I had gone through and made some notes on this stuff the other day. So like in the HPI section, we had talked about it's not always an illness. So what can you put in for HPI? So example, we said CP can list last date of the physical, any current problems. If it's a med check, list out the meds, add new meds or changes. So there's just some ideas of things that you can add there. So then you have your vital signs section, which is the same. It's on the current one. Again, it'll update the vitals and update where it's supposed to in the note. Nothing new really about that. Oh, I'm looking at my sheet like my mouse is gonna move where I'm looking at. Okay. Like I was trying to point it out on my mouse, but that's good.
Hey, Abby.
Yes.
I have a question on the vital signs. Can you add temporal? Because that's how we're taking, most of us are taking temperatures now.
Yeah.
On the drop down.
I brought a paper to write notes this time.
Can you do one of these for the, that might help the lab people?
We are working on it. I am almost out. What?
I click on like 10 different tabs, even in the lab. Injections, medications.
We're working on a new lab form, just so you know.
Which is our command?
Okay.
Not yet.
And the new lab form will actually replace the .lab orders.
That would be so awesome.
So-
I was having dreams about it last week.
.lab orders?
What?
Because I'm
Are we
saying,
getting rid of .lab orders? Okay, we're not going
Yeah,
to
we'll go
.lab orders.
we're not done.
We're not going there.
We're not going the rest of the meeting. We're not going.
Yeah.
Yeah, we can debate .lab orders until tomorrow.
Anyway, okay. So moving on. So we have the medications, allergies, and problems list like before. Again, these little buttons right here, these little check boxes are really, really important for meaningful use. So if your patients don't have any meds, allergies, or problems, if you check those boxes, it's really, really important. We want you to try and reconcile the meds, allergies, and problems list. So, and queue up prescription refills for patients. So on the pre-visit form, it's going to list out the medications for the patient. It'll also give them the last time that they had it prescribed. The patient should be checking on there which medications they need refills for. We want to be able to have those queued up for the provider before they even enter the room. So the provider can just say, yep, 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 and send them off. Same with the problems. If they're there for a physical, it's a really good idea at that point, I mean a physical especially, to go through their problems list with them and update. So we want to make sure that we're reconciling those. Again, that's also something that's really important for meaningful use.
Is that something the medical assistants should do?
It's coming. I'm going to let you answer that question.
You mean delete problems?
Yeah.
Depends on the problem, right?
Right.
So if a patient was in for an upper respiratory infection 4 months ago and they no longer have an upper respiratory infection, delete the problem. It's no longer a problem. So some things are really, really clear cut, and some things you'll have to say, wasn't sure, and discuss it, let the provider go.
And as far as those like more acute problems go, we are working on setting time parameters on those, so that after so long they'll just fall off the problem list automatically. So those kinds of things, that's something that we are working on. We're kind of waiting until we decide whether or not we're going with upgrade, or when we're upgrading. If you make changes here, this button is really important, and I hope you guys all know this. And it's the same on the medications list: reviewed medication list, reviewed problem list, reviewed allergy list with the patient. So it's really important for meaningful use. Okay, the next line. So we have smoking status, same as on the form, right? So there's this next thing here, advised to quit. If the patient says that they smoke, you can go ahead and check this button and just let the patient know that they will be given information regarding smoking cessation. We have changed the after visit summary to where if certain choices are chosen here, that cessation advice will automatically print out on the after visit summary for the patient. So you don't have to give them any advice, you can just let them know that information will be given to them. That is something that when I roll this out, I'll roll that out as well, and then it'll be on the one that automatically goes to the portal as well. So down all of those.
Stephanie?
Did you guys add the hypertension form back to the forms? Through the HPI form?
We didn't take it away, so if
Okay,
it
hasn't
went
been there.
missing, then
It's always been there, it's down at the bottom if they have that problem.
It's usually highlighted in yellow.
So how many of you know that it's there? Okay.
doesn't it show up if it's on the problem list? So if it's on the patient's problem list, it'll show up as an option
In the bottom.
on the bottom, and it should be highlighted, I think, yeah.
Yellow.
The ones that are on the patient's problem list will highlight yellow at the bottom of the buttons.
Oh, highlight.
Yeah. Okay, and then the next section is the alcohol use, and I didn't get a chance to add it before here because my meeting with Dr. Russo was late in the afternoon, but we are going to add the packs per day and the alcohol information to here as well. So that'll be on there before and about Sunday.
Instead of smoking status, shouldn't it be tobacco status?
Yes, that's
Pipes.
Or chewing.
because everybody says that they chew and not smoke. I get that one. Yeah.
Yes.
Well,
Yeah.
yes, and I'll tell you why it's not, right now it's not that way, which I can
It's in the risk.
discuss the change.
Okay.
It's these are the meaningful use options that we have to have in there. So
But
if
you're
it's
right.
not, you are correct. And on the risks form, there is a tobacco section.
Right.
If you choose that type,
Can we make it a slash, like smoking slash tobacco, so that smoking is still in? No, we'll fix it for you.
we will talk about it. Because if you choose an option that's not meaningful use, then we don't get counted for meaningful use. So,
And you know why that's important,
As
right?
You
a
guys-
tobacco user, if they chew and they don't smoke.
Right.
That's, I think, the question. Do
Right,
you-
that is the
Do you
question.
still select them as a smoker if they chew? Because they don't
I would.
smoke.
because they're still using tobacco. I don't know. We will discuss it.
It might not be a respiratory, it might not be a respiratory issue, but it certainly is a nicotine issue, which is certainly a component of, and also an oral cancer alert. So
I just trying to clarify.
yeah, right. I don't know if does anyone know the answer to that definitively? Any leads know the answer to that question? Ever? Okay, we'll clarify. We'll clarify. It's a very good question. We might have to add another reading.
Yeah. Okay. So the last part on here,
Did we lose you?
I think we lost.
Yeah, we lost.
So the last part on here is the review of systems. It's something that the patients do fill out, except if they're in same day, on the pre-visit form. And so we want to go ahead and enter it in for the provider. If the provider chooses not to review it, that's up to them.
This is going to be something where your provider preferences might play a little role in what you do. However, I would like to see if we could at least enter a negative, and then if there's a problem on that problem list that's related to one of these systems here, I would love for you guys to pay attention to that and document whatever the patient's telling you, or whatever the patient has circled on their form. Okay?
Now,
Yeah.
When I use it, I've been doing this for Dr. Stuff for a long time.
Right.
And you click that negative at the top, it kind of fills it in.
Right.
When a lot of the times the patient will have something circled on there, but it's due to the concern. They're being seen for a sinus infection, and on the ENT, they've circled the sore throat, ear pain, or whatever. And there's a selection that says CHPI or problem list.
Okay, right there. So each one of those has a drop down for you to choose from.
Right, and so if you've already noted it in the HPI, that's what I select.
Okay.
So that the doctor knows
That's
that's what
really
it was
good. That's
in
a good
regards
piece of
to.
info. Anybody else?
And there's also like a chronic one, like they circle ears for hearing or whatever. There's like, each one has different things. Because a lot of times you'll get patients that fill them out properly because it's only supposed to be for the last 2 weeks or in relation to the chief complaint, but they will circle everything under the sun. If they felt it in the last year, they will circle it. And then you have to re-ask the
Right.
question
We had
so that you get the proper
Right,
information.
yeah, and that's true. So it does cause you to smile a little bit more and have a little more conversation.
Yeah.
But we were talking with Dr. Blackburn yesterday, and one of the things that he would like is a little more instruction for the patient on completion of this form, so that you circle the appropriate things and cross out those that might not. Now, we're not that far yet, but we could be going to that to help us understand a little bit more and make the patient pay more attention instead of circling everything.
Right.
Yes?
I've had a few of the lab patients actually request, me to remove things from their list while they're in there for a blood draw. And a lot of them I've noticed have commented that they don't have that option to change it in their own chart in like the acute stuff, or remove medications they never even picked up at the pharmacy, like for clonazepam, things
Right,
like
they
that.
cannot alter what's in, they can only view it.
On their My Chart online.
Right.
Yeah, online, they're like, well, there's no way for them to even know that they want those removed online, or...
They can send us a message, a secure message, and say, I was reviewing my chart, I'm no longer on these meds. And we can go from there. All right, we are over time, so just keep us posted. Remember, everything changes all the time at Sound Family Medicine. It's kind of our motto, right? Compassion, change.
So, one thing really quick while Joanne's getting set up here. This form, as we're developing it, there's going to be things that we add over time. These are just the things that currently, right now, most everybody's doing. If you guys, once we roll it out, see that there's something that you think should be added that isn't on there, if feedback on change, please let me know. Dr. Mercer and I will review all of that and make the changes that, would be beneficial to everybody. So I'm going to put this in the EMR Sunday night. So Monday when everybody comes in, it'll be that page starting the office visit versus the one that's currently there. So don't freak out. And phone note, don't forget. Okay? All right.